If your lab has given you a report saying anti-HCV positive or anti-HCV reactive or anti-HCV total antibodies positive, what does it mean? This video I have made only to explain this simple idea. What is hepatitis C? You need to know a little bit about that. Hepatitis C is a virus that infects your liver. It can spread to your body through contaminated blood, body fluids, semen, vaginal secretions and so on, also through contaminated blood transfusions. One of the ways to diagnose whether you have been infected with hepatitis C is through different blood tests. So the test that is usually done is the anti-HCV total antibodies test. It's a first line screening test. Now, when does this anti-HCV test actually show us positive or reactive? So a positive result is only found on this test when the lab actually takes your blood sample and puts it onto this test strip, and they will see two red lines on the test strip, whereas the normal result is just one red line. Some of them will also do it in an automated analyzer in which they will get a value which is starting from 0 and can go all the way up to 100 or so. And in these analyzers, the value will be more than 1. If either of these two situations is true, they will give you a report saying anti-HCV is positive. What it basically means is that there are certain proteins in your blood which have reacted with the test reagents or the chemicals and have given this positive result. These proteins are called anti-HCV antibodies, and they are basically made by your body to fight against the hepatitis C virus. So to make it simple, what does a positive anti-HCV test even mean? It just means that your body has made these proteins to fight against the hepatitis C virus. Why did your body make these proteins? Well, it's obvious. There was a time, sometime in the past, it could be literally at any time in the past. There is no clear evidence about how soon this has happened, but at some time in the past in your history, the hepatitis C virus has entered into your blood and actively replicated to the point where it has caused your body to react against it and make these antibodies. And this test has actually only detected these antibodies. So a positive antibody test tells us that your body was exposed to hepatitis C. There is another situation where there may be a false positive test, in which case you haven't actually been exposed to hepatitis C, but the test is showing positive for other reasons. But as far as we are concerned as doctors, this is the first thing that we look at, and this is what it means. What does past exposure mean in the context of a positive HCV test? So basically, HCV antibodies are the kind of antibodies which can last your entire lifetime. When we say past exposure, it only means that at some point in the past, somewhere you were exposed to the virus. What does exposure mean? It means that the virus got into your bloodstream. How did it get into your bloodstream? HCV spreads through 4 or 5 common ways. One is shared needle use. Second is contaminated blood transfusion. Third is contaminated organ transplants. Fourth and fifth, although less common, are intimate contact without protection, a blood spill, a hospital worker getting exposed to a hepatitis C patient, during a procedure, there is an accidental needle stick injury. These are all the ways in which you could have been exposed to it. But past exposure just basically means that any time in the past, there is no relevance to when. It could be at any time. So does a positive HCV antibodies test mean that you currently have the virus? The straight answer is no. It is impossible to say based on this test whether you currently have the virus. As I've already explained, it only tells us whether you were exposed to this virus in the past or not. Whether you currently have the virus, whether it is actively replicating, whether it is present in your bloodstream, cannot be determined on the basis of this test. So what is the test that can actually tell you whether the virus is currently in your body and replicating? Well, the only test is the HCV RNA PCR test, which is basically also called the NAT test. This is the test that actually takes a look at whether it can find the real HCV virus itself in your blood, and this is the test that you need to do if they give you as anti-HCV antibodies positive.